passive muscle release is basically me moving Michael through some movement, which actually feels good because you're able to stretch and open chest muscles without actually having to use your own muscles to create it, like if you were lifting your own arm or taking your own arm back. Okay? So basically what I'm doing is supporting Michael from the wrist, not at the hand because that's going to feel like it's stretching his wrist, but here at his wrist. So I'm supporting him at the wrist, and then and you may initially find there's some resistance to them allowing you to move their arm, but just give it a little rock and shake, and if there is some resistance, that's fine. If you need to support them a little more from the elbow, if they need more support, again, you just communicate with the person you're working with, and just free form kind of movement. We're just free forming movement with the shoulder, and then we can get to some nice stretches here by taking a hold of the wrist again, not the hand, but the wrist, and stretching directly out to the side, which is going to give them a nice stretch across the chest. You can take it a little bit to the floor. Again, I recommend just communicating with the person that you're working with so that you're not taking them into any area of discomfort. How are you doing, Michael, with that? Good. And then when you bring it back up, you bend the elbow. And then we're just going to take it right up towards the ceiling. Again, you can see I'm holding the wrist, not the hand. I'm drawing up. That's going to give him a stretch even into the back here. And you just take a few breaths there with them. Let them breathe a few moments into that. Maybe 4 or 5 breaths. Then I slowly come in and I slowly come out. You notice I'm not yanking his arm around. Just nice slow movement. Now I'm taking one foot, stepping it forward, and then leaning forward, taking his arm back. This one usually feels particularly good. So stretch across the chest. Yep, and give him a few moments to breathe there. And then slowly, I bring the arm back. You can give it a little shake again. And let the arm release. I'll show that on the other side too so you can see it again. So the biggest thing is just making sure you feel like you're really supporting your loved one here. So again, by the wrist is going to be the best place to do so. If that feels like there's a lot of resistance, again, you could support them by the elbow too. So again, I could just take him through a little bit of movement here. Just kind of impromptu, free form movement. Again, there's no right or wrong on this. Just anything you think of here. Creating, think fluid, like the ocean. And then we did a little bit of rocking. And then facing towards the head of the table, I have a hold of the wrist. And I'm taking a step out to the side to open the chest. Again, a couple of breaths there. I slowly let the elbow bend. I come back in. I take one foot forward, and I go straight up to the ceiling, supporting at the wrist. So you notice I came slowly into that. I don't want to go straight overhead yet. I just want to slowly let the arm come back to neutral position. So I'm coming kind of neutral in the shoulder where it's relaxed so that when I step back, it doesn't feel weird in his shoulder. Again, just communicate with them. It might take you a few times to get used to these techniques, but after a few times, you'll probably find it feels more comfortable in your body, and it's all about just creating some communication with you and the person you're working with. You're all here for the same purpose. So, and then again, we bring it back, give them a little rock, and then back with the hand to the side. So again, the purpose of that passive release work is so that you can passively allow them to stretch chest muscle and feel all sorts of great range of motion, which your client might not be able to fully experience on their own, depending on the strength of their muscles at this point. So it's a nice way of them getting some range of motion and openness again in the chest muscle.